So my name's Dr. Josh Neumiller. I am a pharmacist. I'm on faculty at Washington State University, and I'm also a certified diabetes educator. It's really been an explosion as of lately for the amount of drugs we have available to people with diabetes. And so the SGLT2 inhibitors, they work in the kidney, and now we actually have 3 drugs in this drug class available to patients. Invokana is one, Farxiga is another, and Jardiance is another. And these drugs, they work a little different. They actually work in the kidney, so the kidneys actually filter the blood and actually filter glucose, and normally the kidneys actually reabsorb all that sugar back into the bloodstream. And what these drugs do is they actually inhibit the major transporter that recovers this sugar. So if people with the type 2 diabetes, for which these are approved, use these medications, they actually release sugar through the urine that helps lower blood glucose. And the other potential benefit of this that people realize when they're treated with these drugs is they lose calories in the form of sugar through their urine too. So people actually also lose weight with these medications. Because they work in the kidney and they require the kidney to be filtering that sugar, they're not a good option for people with chronic kidney disease. And because these drugs do increase the amount of sugar in the urine, some of the main side effects are genital fungal infections. Particularly women can get some yeast infections with these medications. There is a small increased risk of urinary tract infections with these drugs as well. And something that's also good that people be aware of when they use these medications is because they are causing glucose to be, or sugar to be spilled through the urine, is they work a little bit like a diuretic or a water pill. So with SGLT2 inhibitors, the average A1C reduction that people can achieve with these is about 0.7 to 0.8%. Toujeo, this is a new longer-acting insulin for people who need long-acting basal insulin. There was another product that many people are aware of named called Lantus, and what Toujeo is actually a more concentrated insulin that uses the same drug, the same form of insulin, but most insulin comes in what we call is 100 units per milliliter, and this particular drug is 300 units per milliliter, so it's more concentrated. And in concentrating this long-acting insulin, a couple potential benefits of that, it works longer than 24 hours, and so some people who use other long-acting insulins, it tends to wear off before the day runs out, whereas with this insulin, it tends to last a little bit longer. And the other advantage of that is for people who take very high doses of insulin, because this is a concentrated insulin, they can get away with smaller injection sizes, so they can have less injection site pain. It's approved for people with both type 1 and type 2 diabetes, and similar to really all the insulin products, the main thing people have to be aware of is low blood sugar or hypoglycemia risk. But the nice thing about this particular long-acting insulin, it's very flat in terms of its action, so relatively low risk of hypoglycemia. And in terms of A1C lowering with Toujeo, as is with most insulins, the nice thing about insulin is we can titrate it as much as we want to get people's A1C low. So for people who have quite elevated A1Cs, insulin is our go-to medication. The very nice thing about Toujeo is the manufacturers of this insulin make it only available in a pen device where the patient doesn't even have to worry about any conversion. They just dial it to the dose they need. So Afrezza is a new inhaled insulin. It's for mealtime use. So for people who need a little bit of insulin with their meals, this is a new option, and it's an inhaled product, which is really something we haven't had for a while in the insulin space. And so this insulin, it has a small inhaler where they put cartridges into this device and inhale their mealtime insulin dose, approved for people with type 1 and type 2 diabetes. And people who shouldn't take Afrezza, and it is a little different, this insulin product, because it is inhaled, and so particularly for people who have lung disease, if they have asthma, COPD, or people who smoke, they're not good candidates for using this particular product. So side effects with Afrezza, similar to other insulins, hypoglycemia, we have to be aware of that. As really any insulin product, that's one of our main concerns is hypoglycemia. The very nice thing about this product is it's our most rapid-acting insulin we have currently available. So it works very quickly, and it's out of the body fairly quickly. So compared to some other insulins people take at mealtime, it probably has less of a hypoglycemia risk if used at appropriate doses. And there are many, many drugs in the pipeline pipeline. And so over the next several years, patients and their caregivers and their prescribers will see a lot more agents to pick from.